Are you thinking of getting a dental implants, or do you have already a dental implant in your mouth? Listen to this exciting episode interviewing the inventor and one of the manufacturers of dental implants in the world, the living legend, Dr. Gerald Nesnick. He is considered the godfather of modern implant dentistry in the world. This is an exciting episode that you don't want to miss. Don't forget to subscribe, like, and share. Thank you. Hello, and welcome to this exciting episode of the Wonder Tooth podcast. Today we have a legend, a living legend. Welcome to the show, Dr. Gerald Nesnick. Thank you so much. We are so honored to have you today. For you guys who don't know who Dr. Nesnick is, so Dr. Nesnick is my alma mater. We graduated from the dental school, the same dental school in Winnipeg, Canada, University of Manitoba, that they named it after him now. It's called now the Dr. Gerald Nesnick College of Dentistry. Welcome to the show.
Thank you.
So if you guys have a dental implant, or if you are thinking about getting a dental implant, Dr. Nesnick, actually, he is the inventor of certain types of dental implants. He manufactures them. Dr. Nesnick is a living legend, guys, and he is the living godfather of implant dentistry in the modern dental world right now. So let's talk about how did you start this? Why did you even become a dentist in the first place?
Well, that's an interesting story. When I lived in Winnipeg, my parents lived in a small town a couple hundred miles from Winnipeg, and they sent me into school to study. And when I was about 15, I had to go, 16 maybe, I had to go to a dentist. I had a filling, and the dentist, apparently it was a pin ledge amalgam. It was a very big restoration, and he charged $25. And I thought, wow, what a great way to make a living.
Mm-hmm.
I was going to go into either medicine or dentistry, and that sort of swung me towards dentistry, thinking this looks like it's fun and it's rewarding. The funny story is 60 years later, I visit my mother-in-law in a convalescent home in Winnipeg, and there is this dentist.
No way.
Did this filling, and I went over to him. I said, you influenced me. He had a practice on Corden. I said, you influenced me into going into dentistry when you did that filling for $25. He says, I remember the tooth. It should have been a crown, but your dad wouldn't spend the $100.
Oh my God.
So this tells you a lot about dentistry, how dentists, how they remember a tooth for 60 years. Anyways, I decided to go into dentistry, probably because it was a couple of years shorter than medicine. Being the child of being first generation in Canada, my parents were born in what they call the old country, but came over as babies. The ambition of the parents is that their children get a good education. So I had to pick a profession, law, dentistry, medicine, and I took dentistry. I got into dentistry, fortunately, right out of second year college. So I was 19 years old when I entered dentistry.
Wow. Mm-hmm.
Between third and fourth year, between the second and third year, I got married. And between third and fourth year, my wife and I took a trip to California, and I visited USC Dental School, and I learned that they had a program for students, a one-year prosthetic certificate program. And I thought, well, this is a great way to get ready for the California boards, which were very difficult. Mm-hmm. You needed gold foils, you need to set up teeth and do a filling. So I applied, I was accepted on graduation. I went to USC for a year, studied prosthetics. The beautiful part of it was that I could attend free any of the weekend courses, and they had the top speakers in the world coming through USC on weekend courses. And my advice to dentists is you'll learn more after you get out of dental school with these short postgraduate courses.
That's
So
so
after
true.
I did the 1 year and I got my California boards, I wanted to make it a specialty, which requires at least 2 years. So I went to Indiana University, spent a year and a half, got a master's in prosthetics, and at 26 came back to California and started a practice in an area called the San Fernando Valley. I was the only prosthodontist in an area of 1,000 dentists. So I wanted to do crown and bridge, but most of my referrals were coming in as dentures. You can make the best denture in the world. It's not going to be very stable on the lower jaw. I realized very early on that implants might be the solution to stabilize the lower denture. So by 72, I got involved with the American Academy of Implant Dentistry. I started placing the kind of implants that were available at that time, subperiosteal implants. That's where you lay the tissue back, take an impression of the bone, and make a framework that gets trapped between the tissue and the bone. Very good and predictable in the lower jaw, not suitable for the upper jaw. I did blade implants where you cut a slot and you tap in this blade, usually connected to a natural tooth as a distal abutment. Did some screw implants. And what I found was they were very unpredictable. And by the end of the 70s, I was somewhat disillusioned with this predictability and was ready to quit doing implants, frankly.
Wow.
But I went to one meeting and there was a company there representing Zest Dental, Zest overdentures.
Yeah.
And they had developed a screw that took the Zest attachment. It just had a hex hole in the top, and you'd cement the Zest attachment so you could do 2 implants for an overdenture. And I thought, wow, this is the solution I'm looking for. Simple, predictable, and they were looking for 10 dentists to do 10 implants. I went back to LA and I called Zest. I said, you don't need 10 dentists doing 10 implants. You need me doing 100 implants. And I had a big practice and a lot of edentulous patients. So they came down the next Friday, brought some implants. I brought in 3 patients and I put in implants in the symphysis. And then I spent 6 to 8 months improving and developing the technique. I realized if you buried the implant, like we were doing with the compromised teeth, we would actually do root canal, bury them for a while until they firmed up. So I thought I'd do the same thing, submerge the implant. And
which means to put it underneath the bone a little bit.
Well, no, under the tissue.
Okay.
Submerge under the tissue. And I left it a little bit above the bone so it's easier to find when you run your finger along.
Yeah.
So anyways, I got these working pretty good. I developed internally irrigated drills to cool it. I found that when they failed, it was because you overheated the bone. So I perfected the technique, and I remember thinking that this is going to work, but it's very limited. So I sat down on a napkin and I designed an implant, which became the Corvent implant. And what happened is Straumann had a basket implant and a screw implant. So I combined the 2 designs, came up with the Corvent, found a machining shop that could make it, and made some drills and started putting those in. And that became the Corvent implant. I tried to find somebody to market it. I remember going to Sterngold and saying, look, if you just spend $30,000 a year on marketing, I'll give you the distribution rights. I didn't know how successful this was going to be. This is all pre-Bronnemark, pre-osseointegration. They didn't want to do it. So I decided, okay, I'm going to market it myself, but what I'm going to do is market education. So I started giving courses and training people on how to place them. did live surgical courses at my office every week, every Monday, Tuesday. Then on Thursday and Thursday, I'd fly to a city. I'd give a lecture Friday, Saturday, come home Sunday, work in the office. Monday, Tuesday, start another course. And I did this for a couple of years, maybe 4 years.
Which year was that?
That was 83, 84, 85, and 86. By 85 and 86, I had distributors around the world. I started traveling to many different countries to give lectures, to do demonstrations, and basically spread implants around the world. What happened was that in 82, unbeknownst to me, University of Toronto had a symposium where they invited all the professors from different American universities to introduce the Bronnemark system.
Mm-hmm.
A friend of mine had a friend who had attended it, and I contacted that person and got the name of Bronnemark. I went to the USC library and read Bronnemark's 77 textbook, and I was very impressed to see that he had done long-term research on implants that became ankylosed.
Mm-hmm.
And my implants were becoming ankylosed. And his study just showed if you got ankylosis, which he called osseointegration,
Mm-hmm.
you'd have long-term predictability. So I started lecturing on his research and my implants, and that started implants in the United States, really. By 1984, Bronnemark launched their implants, very, very expensive. I think 20,000 for a minimum. Their courses were expensive. They only let oral surgeons and prosthetologists. Mm-hmm. And I was opening it up to the general dentist. So by 1986, I came up with another implant called the screw vent, which mm-hmm. had a lead-in bevel internal hex connection with internal threads, so we could make abutments. The core vent had cemented abutments. The screw vent had screw-retained abutments. That connection has become the cornerstone of modern implant design. Everybody has got internal conical connection.
Internal, yeah.
It doesn't matter what the angle's 45 or 60 or 70 or even 83, like Straumann's new one. They both provide lateral stability and take the stress off of the screw so the screw doesn't come loose.
So how did you come with this specific invention?
Well,
what made you think about this specific invention?
Bronnemark had an external hex with a screw. Mm-hmm. And you have an external hex and lateral forces are flexing the screw and it's slipping off the shoulder.
Unstable, yeah.
So I just figured if I go internal with the abutment having the hex, the screw is protected in the center of the abutment and it won't flex and you won't get looseness. Now, what this did is it allowed dentists to put cemented crowns on implants. Mm-hmm. Because if you screw in an abutment and cement a crown and the abutment comes loose, you're sort of screwed.
Yeah.
So internal conical connection really made the difference. Later, I came up with friction fit connection by taking that male hex of the abutment and tapering it 1 degree, and you tighten it down. It takes 30 Newton centimeters just to seat it. At that point, you could take the screw out and throw it away. You cold welded the part. So I was all about mechanical advantages. When I went to USC, my minor was in dental materials, major was in prosthetics. So that took us up till 1990. I started adding other implants. The cylinders became popular. Ledge implants became popular besides screws. So I added implants to the Corben system. And in 1990, I had 4 different implants and I had to have some way to tie them all together. So I came up with sterile packaging. Prior to that time, nobody was doing sterile packaging. And you had to attach a carrier onto the implant to insert it. So I came up with mixture mount packaging where I packaged the carrier with the implant and sterilized it, pre-sterilized it, and launched the Spectra system in 1990. In 1991, Dentsply came along and said, we want to distribute your product. And so they took over the distribution for 6 years, and I just did the manufacturing. And when they took over, Corvette was the largest implant company in the world in volume sales.
Wow.
So they didn't do a great job of marketing. I took it back in 97, launched a number of new products, and in 2001 sold it to what today is ZimV.
ZimV.
ZimV is still selling but 99, I made the screw vent tapered called the screw vent, and they're still selling the tapered screw vent as their flagship product. They called it V. They came up with a slight variation without the vent, which they call TSX, but it's the same connection, same body, same threads.
And do you manufacture them at your facility?
Well, I did. I built in 94 during the Dentsply era. I built a new factory making the implants. And when I sold to ZimV, it was actually Calcitech and became Seltzer Dental, and then it became ZimV. They took over my factory for a couple of years, and I was basically retired. But what happened in 94, the lease on the factory had expired, and rather than them sign a new lease, they moved everything out of the factory to consolidate with the San Diego office that they had, leaving 80 or 90 of my former employees out of work and an empty. So I decided I'm going to go back into business again. So in 2004, I started Implant Direct. And it took me 2 years to build the product line, and launched it at the end of 2006, and developed a number of implants. The Legacy, which was like the tapered screw, but with micro threads, and that became, and without the vent, that became the flagship product. Number of one-piece implants for application-specific things. One thing I want to say about the Corvette is all it had was a hex hole into which you could cement an abutment. So you could cement a variety of different abutments depending on the prosthetic application, for an overdenture, a screw retained, a cemented, and that really introduced application-specific abutments to the industry. That was probably one of my biggest contributions, is different abutments for different clinical applications. With the Implant Direct, I wanted to come up with application-specific implants with all-in-one packaging. So that's what we did, is we put the abutment, the transfer, the healing collar in with the implant, simplified ordering and inventory, saved money, and Implant Direct became very popular, really took over the general practice market. We had a lot of specialists as well. And by 2010, a company called Danaher, which later they had Cybron. They owned Cybron. They wanted to buy my company, so I sold them 75% in 2000 and at the end of 2010, and the other 25% at the end of 2013. And basically retired. I stayed on as president for 3 years, built it into a company doing well over $100 million in sales globally, and retired. My non-compete expired in March of 2022, and I had the factory was empty.
Oh, the factory was still empty. They didn't take it.
Well, I didn't renew the lease when I sold to Danaher, and their lease up in 2014. I didn't renew the lease on them. Moved to another facility that we had not far away, and I kept that building, thinking someday I'm going to go back in. But it took me so long to get through the non-compete. So March 2022, I started a new company called Paragon. And actually, it was a name that I had used back in the 90s. When I took back from Dentsply, I called it Paragon. So I reused the name Paragon, started back in the factory, bought all new machines. We have 26 machines now. 35 or 40 of my former employees that were working for Implant Direct came back to work for me. And
Wow.
I developed a number of new products, and we have yet to launch. We are waiting for FDA approval, which should be in March of next year, and Paragon Implant Company will launch the 5th generation of Nesnick implants, which I call Generation 5.
That's impressive. And you are going to manufacture them at the facility?
Oh, yes, I've got 26 machines and 80 or 90 machinists working at the factory right now.
So per day, how many do you anticipate you're going to be manufacturing a day?
Well, each machine can make 7,000 or 8,000 implants in a month.
Wow.
So, but you need so many, need different machines for different diameters, different lengths, then all the abutments, the screws, the transfers, the carriers. There's so many different components that go into a system. So we're geared up to really hit the market in a big way.
This is going to be fantastic. So every patient now, you should start to ask your dentist if they're going to place an implant. What kind of implant is it? Is it a ZimV, or is it a Legacy, or is it a Paragon that's coming up? And you should ask specifically for those implants, because you see the man who actually invented them is manufacturing them like right now. A true legend.
I used to say, when I went into first year dentistry, I had unconscious incompetence. I didn't know what I didn't know. By second year, I had conscious incompetence. Now I knew what I didn't know. By third year, I had conscious competence. If I focused, I could do it. But by fourth year, I had unconscious competence. It was coming natural. But now at 82, I'm more concerned about unconscious incontinence.
Yeah.
That's my advice to dentists is you have a moral obligation to know what the hell you're doing.
To what you're doing. I agree.
And I know,
and that's fantastic, because that's the only way really to live your life and find your purpose.
Yes.
So what is Dr. Nesnick's purpose?
Well, to bring a little honesty to the dental implant industry.
I mean, just listening to you and the passion in this conversation is very contagious. And I'm like, right now, I was like, oh, I feel tired, but no, there is a lot of stuff that I'm gonna do now. And I'm humbled by this opportunity really to talk to you completely.
I'm very impressed with you and the practice that you've built. I don't know that I could do what you do.
Thank you.
So it's nice to meet you, and thank you for doing this interview.
And express to you how honored and how happy I am to meet you, the living legend, Dr. Nesnick, the godfather of the current, like the modern implant dentistry. Thank you so much. Thank you so much. And I'm gonna put the show notes in the show notes how to like the website of Paragon, and also to answer any questions regarding implants or the shortcomings for certain implants. I'm gonna put that in the show notes as well for people to check and basically find out what's good, what's bad from your point of view.
Great. Thank you very much. Great meeting you and my new best friend.
Yes. And I'll come to you I will come to Connecticut.
Good.